The Sweet Truth in Science, Unraveling the Past, Present, and Future of Blood Sugar Monitoring Throughout Chemistry. So what is blood sugar monitoring? It measures the amount of sugar, also known as glucose, in your bloodstream, leading to the question of what is blood glucose. It's a monosaccharide simple sugar molecule that serves as the body's main source of fuel. That fuel is then distributed into your body's cells as an available source of energy that can be used throughout the day. Most common foods that include glucose are fruits, vegetables, and dairy products. The chemical formula of blood glucose molecules is C6H12O6. If your blood sugar is off, various symptoms such as dizziness, increased heart rate, and a response to the fight or flight reaction may occur. As a result of these symptoms, hyperglycemia, which is high blood sugar, or hypoglycemia, which is low blood sugar, may come about. In order to fix these, insulin can be used. But let's take it a step back. What is insulin's effects on the body's metabolism? It's a naturally occurring hormone where your pancreas utilizes to move glucose into the cells. It stimulates excess glucose into glycogen, in which it's stored in the liver and muscle tissue. Displacement of this glycogen is what causes diabetes, a chronic condition on how glucose is used. And there are two types. In type 1, the pancreas makes little to no insulin secretion, leading to high blood sugar. This can be onset, rapid, and lead to immediate treatment of insulin. Most of the times this is diagnosed before the age of 30. In comparison, type 2 diabetes is when the body has trouble controlling the insulin action or not enough insulin is produced, leading to an offset imbalance. Gradual symptoms may occur and can be controlled with a diet, oral medication, or a severe enough insulin. Most of the times this is diagnosed, however, after the age of 30. So now let's talk about some ways to measure blood sugar. This can be used as a key tool for people with diabetes to measure and manage their blood sugar levels. However, individuals without diabetes can also use this to prevent, or if it's genetic, predict diabetes. One of the ways to measure blood sugar is through blood glucose meters. It's a handheld device in which a small drop of blood from the finger or arm can be placed on a test strip. Results come back via on a meter. The second way is the most expensive and the most common, continuous glucose monitoring, also known as CGM. It's when a sensor is placed under the skin and is continuously measured the levels. The data is then sent via Bluetooth or wirelessly to an iPhone or some type of smartphone for real-time readings. The third and final way is used most common in the healthcare fields, the oral glucose tolerance test, also known as the OGTT. This is a medical procedure that involves drinking a sugary solution and then getting your intervals checked. This can be used to diagnose prediabetes as well as diabetes. So let's start from the beginning. In 1841, a chemist by the name of Carl August Tromer discovered the foundation for lab-based diagnostic tests of sugar levels in urine. This was the beginning discovery of diabetes and insulin. In 1865 to 1915, insulin and the pancreas were discovered to be connected with one another by using dogs with undiagnosed diabetes. Various scientists such as Oscar Minkowski, Paul Langmuir, and Joseph von Mering were the ones who contributed to this. However, in 1916 is when diabetes was confirmed, as it was discovered because of the lack of insulin production among the pancreas. Following diabetes being founded, here are some of the key developments, including in 1956 when glucose, a urine test strip, was produced. It was based on how much glucose was in the bloodstream by test strip color, and it was the first way of monitoring glucose. In 1964, COMBR, which is a test strip used to screen for prediabetes and monitoring sugar in the bloodstream, was also produced, in addition to dextrose strips, which is a reagent strips used for rapid estimation in the blood. While these were not the most accurate, in 1974, cumbersome Reflomat, which is an automated system for reading blood sugar values, was produced as well. The three of these were not the most accurate, leading to, in 1999, the Dexcom, which is now the most popular and biggest brand of continuous glucose monitoring, was developed, though in 2006 it was FDA approved, as the first CGM to be approved. From 2018 to present, the Dexcom G6 and 365 glucose monitoring system is the newest FDA over-the-counter monitoring system. Future developments include the integration of AI in predictions, longer-lasting implantable sensors, and automated insulin delivery systems, smaller devices, and more over-the-counter accessibilities. In addition, updated software is needed to stay up to date with technology advancements. Now let's get into the chemistry of it. Test strips, meters, and continuous glucose monitoring are based on an enzyme that reacts with glucose to produce an electrical signal, which is essentially the readings in a result. But first, glucose is an aldohexose, which is a 6-carbon sugar with 16 configurations of monomers. The most common enzyme that results with this is glucose oxidase. Glucose is oxidized into gluconic acid, to which glucose and oxygen are used to produce this acid, in addition to H2O2, which is essentially hydrogen peroxide. Hydrogen peroxide produced with the enzyme breaks down glucose. It is then used with peroxidase and hydrogen peroxide to create colored chromogen, which is used to show the intensity of the color on the test strips. This essentially also leads to color formation to measure the blood sugar levels. The final step is glycation, which is a non-enzymatic chemical reaction between sugar, also known as glucose, and proteins. The formation of new and improved blood sugar monitoring tests have been impacted by other fields such as bioengineers, computer science, and government-regulated industries. The first one being bioengineers, who are the ones who design the physical components of modern devices by creating non-invasive, less harmful bodies to your skin and organs. In addition, they create the sensors that are flexible, durable for normal lifestyles. And finally, they use glucose monitoring as a way to replicate the pancreas as a closed-loop system. Computer scientists are the ones who analyze the insights of glucose, data trends, and predict future spikes of insulin before they even occur. They also provide visual graphs and information to help patients better understand their health in future situations. And finally, the Food and Drug Administration, also known as the FDA. They provide regulations and safety standards for monitoring systems. In addition, they also provide approval and clearance for tracking glucose. Finally, they ensure durable medical equipment, benefits out of insurance, and issue safety warnings. Now, we all know that blood glucose monitoring has an impact on our society, as diabetes is one of the most diseases nowadays. Some of the positive societal impacts include the sense of control, confidence, and management, as it monitors and helps with stressful social cues of empowering others with knowledge, as well as better understanding it yourself. It also provides information to healthcare workers, as precise adjustments about patients' data based on their lives can be helpful. In addition, future insights such as preventing future manic episodes of diabetes, hyperglycemia, and hypoglycemia. It also optimizes the behavior, diet, and sleep of their patients. And finally, it helps reduce complications as it increases the amount of control. However, some of the negative societal impacts include the cost and bias, which is the high cost of individuals susceptible to buying these items. In addition, data vulnerabilities and content, such as the amount of health data included on these things, with security breaches and risking patient privacy, and raising questions about ownership. Finally, fear and distress, which provides burdens on families with children, as well as psychological distress and stigma around high readings. In conclusion, the effect of insulin and glucose needed to be monitored on a day-to-day basis of individuals who have these conditions can be stressful. Though now with the blood sugar readings that we have today, from the late 1800s to now, the advancements we see today of new monitoring devices can be influential on the day-to-day lives of those with and without diabetes.